Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. The result is chronic pain, which is termed failed back surgery syndrome, or FBSS. It's one of the most frustrating things a patient can deal with, since he or she went the surgery route hoping for a pain-free outcome. Studies show that up to 40% of all back surgeries fail, and 10% of back surgery patients actually end up worse than they were before the surgery. Each additional surgery that is performed has a lower chance of success than the one before. It can be an exceptionally depressing situation. Why does failed back surgery syndrome occur? Well, it could be that surgery was performed for the wrong reason. Studies show that half the time, doctors are unable to figure out the exact cause of a person's back pain. It could be that surgery was performed for the correct reason, but the person was left with residual pain anyway, even if it was a technically perfect surgery. It could be the surgery was inadequately performed. Maybe it was done fine, but the fusion didn't occur and the hardware ended up breaking. It also could be that the outcome was great initially, but then either scar tissue formed around nerve roots, the hardware became painful, or the levels above or below began to degenerate. Here's an example of adjacent segment degeneration. You can see a fusion done at these two levels. You have the cross connector here, and basically above you have severe breakdown. Okay, it's actually auto-fusing with the bone going there. So here's the two levels that were fused. See how bad this is broken down. That's adjacent segment degeneration. So the symptoms of failed back surgery syndrome may include daily back pain. It may radiate into the buttock or the flank area. Spasms and aching may occur, and if a person has some nerve pinching, there can be leg pain and burning called sciatica. Treatment options for failed back surgery syndrome. First and foremost, the person should have a surgical evaluation just to see if a revision is in the cards. It could be there might be broken hardware, adjacent fractures, maybe the fusion didn't occur. Whatever the case, physical therapy and chiropractic treatment can help. Spinal decompression therapy is a computerized intermittent traction treatment. If a person has hardware in place, it's contraindicated. Acupuncture, and then medications either over the counter or prescription. Interventional procedures may include trigger point injections, which are great for a person who has spasms. Hardware injections, an injection around the hardware can see if in fact the hardware is a painful contributor to the failed back surgery syndrome. Facet and medial branch blocks may be very helpful for adjacent segment degeneration. Epidural injections, if a person is having a pinched nerve and leg pain, those can be extremely helpful. And then radiofrequency ablation, if you have a facet or medial branch block and it works and then wears off, then here's an example of radiofrequency ablation where the catheter is put in, it's heated up around the area of the joint, and it deadens these little nerve endings, and it can provide exceptional pain relief. Okay, that can provide pain relief for 6 to 24 months. Now, as an absolute last resort, a spinal cord stimulator implant has been a revolutionary treatment. It's dramatically improved over the past decade. They just keep on getting better and smaller. It's good for both back and leg pain. There's over 200 program options available with the newest ones. Over 75% of patients do extremely well with the spinal cord stimulator implants. Remember, it doesn't fix the problem. Essentially what you have is a battery/programming unit with electrodes going around the spinal cord area, and basically it just changes the way the brain perceives pain signals. It changes pain for a tingling sensation, but so it masks the pain. But if it can't be fixed, why not mask it? The top pain management in Texas is through the TEX-PAIN Network. There are several clinics throughout the Dallas-Fort Worth Metroplex area, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.